Hello and welcome back to our video series on pharmacology. In this video we will be discussing chapter 22, Chemotherapy Drugs. Learning objectives for this chapter: name several categories of chemotherapy drugs, compare and contrast the therapeutic effects of antimetabolite chemotherapy drugs, alkylating chemotherapy drugs, and demethylating chemotherapy drugs. Describe how the therapeutic effect of antibiotic chemotherapy drugs differs from that of regular antibiotic drugs. Explain why hormonal chemotherapy drugs are only used to treat certain types of cancers. Compare and contrast the therapeutic effects of mitosis inhibitor chemodrugs, platinum chemodrugs, chemotherapy enzyme drugs, and retinoid and Rexinoid chemotherapy drugs. Compare and contrast the therapeutic effects of interleukin, interferon, monoclonal antibody chemotherapy drugs, and immunomodulator chemodrugs. Explain the role that corticosteroid drugs play in treating cancer. Describe the advantages of using a chemotherapy protocol to treat cancer. Describe the types of drugs used to treat and the side effects and toxicity of chemotherapy drugs. When given the name of a well-known chemotherapy generic drug, identify the trade name. When given the generic and trade names of a chemotherapy drug, identify the drug category to which it belongs. When given a chemotherapy drug category, name several drugs that fall in that category. And lastly, when given an ending common to several generic drugs, identify the related drug category. Alright, we'll start with a quick introduction. The term neoplasm is a term that means a new growth of cells. This new growth can either be benign or malignant. And all malignant neoplasms are classified as a cancer. And as cancerous cells invade tissues and organs, normal function is now compromised. And sometimes the impairment is to the point of death, unless this is corrected with surgery, radiation, or chemotherapy drugs. Now, to properly treat any type of cancer, the physician must determine two very important things. The first one is the type of cancer, and this is done by biopsies being taken from the tumor site, or also blood specimens that are drawn to examine the blood cells. And the second point is the stage of the cancer. This shows the extent of the cancer progression, as indicates whether or not the cancer has spread to secondary sites in the body, such as lymph nodes or other parts of the body in general. So the selection of an appropriate chemotherapy drug is based on the type and the stage of the cancer. Now, a treatment that is appropriate for one type of cancer is usually not appropriate for a different kind of cancer. It may not even be appropriate for the same cancer that's progressed to a more advanced stage. Drugs that are used to treat cancers or malignant neoplasms are known as chemotherapy drugs, or can also be called anti-neoplastic drugs. Chemotherapy drugs are the most effective when they are initiated during the early stages of cancer, when there are fewer cancer cells present in the body. Most chemotherapy drugs exert their effect against rapidly dividing cancer cells. However, there are some normal cells that we have in our body that also divide rapidly, including the cell lining of the gastrointestinal tract, hair cells, and blood cells. So those cells are greatly affected by chemotherapy drugs. So this can lead to inflammation of the mouth and also the GI tract, the loss of hair, and a decreased number of white blood cells and red blood cells. The term that we'll go over here: adjuvant therapy. This refers to chemotherapy or radiation therapy that's given to a cancer patient after they've had surgery to remove a tumor. And the whole purpose of adjuvant therapy is to help in eradicating any remaining tumor cells. And the phrase is actually taken from a Latin word meaning aiding. Now, remission occurs when cancer cells have stopped actively reproducing. Now, some cancer patients will experience a complete remission after chemotherapy. Some may only have a partial remission after chemo. And some actually will experience tumor growth while being treated with chemotherapy. And sometimes chemotherapy does not work. So some examples of failed chemotherapy would include when a tumor size increases despite the patient undergoing chemo. There are new metastatic lesions that appear despite going through chemo. At this point, a new combination of chemotherapy drugs may be tried. Alright, the first category of chemotherapy drugs we'll talk about are the antimetabolites. And these kinds of drugs will act against metabolites, which are important byproducts that are produced from other substances in the cell during the normal process of metabolism. So metabolites are active in the production of cellular DNA. So antimetabolite drugs will block an enzyme that produces an important metabolite, because they take the place of a metabolite. And this category of drugs is used to target rapidly dividing cells, such as cancer cells, because they have a high rate of metabolism. And there are various different kinds of antimetabolite chemotherapy drugs. And one of those are the purine analog chemotherapy drugs. And the purine is a molecule that forms the base upon which adenine and guanine are built. Adenine and guanine are two of the four nitrogenous bases found in DNA. So the purine analog will take the place of the purine base structure. So when this is here, the normal metabolites, adenine and guanine, can't be built. So if they can't be built, or DNA can't be produced. If DNA can't be produced, cancer cells can't divide. And this class of antimetabolites, the purine analogs, are used to treat many different kinds of cancers. Some examples of this kind of antimetabolite drug would include cladribine, known by its trade name lustatin, chlorpharabine, known by its trade name Clolar, fludarabine, also known by its name Fludara, mercaptopurine, known by its trade name Purinethol, pentostatin, known by its trade name Nepent, and theoguanine, known by its trade name Tabloid. Now, a class of the antimetabolites that's related to this is the pyrimidine analog chemotherapy drugs. And the pyrimidine is a molecule that forms the base which cytosine, thymine, and uracil are built. So the other two nitrogenous bases found in DNA, cytosine and thymine, are classified as pyrimidines. And uracil is a modified form of thymine that's found in the compound RNA. And it's like we saw with the purine analogs. The pyrimidine analogs will take the place of the pyrimidine base structure. So normal metabolites, such as cytosine, thymine, and uracil, can't be built. If they can't be built, DNA can't be produced. If DNA can't be produced, cancer cells can't divide. And just like we saw with the purine analogs, the pyrimidine analog chemo drugs are used to treat many different kinds of cancers. And some examples of this category of the antimetabolites include capecitabine, also known by the trade name Xeloda, cytarabine, known by the trade names Terabin and Deposit, floxardine, known by the trade name FUDR, fluorouracil, known by the trade name Adracil, gemcitabine, also known by its trade name Gemzar. Another type of antimetabolite drugs are the folic acid blockers. Now, folic acid is a B vitamin whose metabolite is important in the production of DNA within a cell. And these blockers act as antagonists because they will compete with folic acid for the same enzyme. And this enzyme will normally change folic acid into the metabolite that helps to deliver purine when forming the DNA molecule. So without that folic acid metabolite being made, purine isn't available. Purine isn't available, DNA can't be produced, and therefore cancer cells can't divide. And these kinds of drugs are used to treat many different kinds of cancers. And some examples of a folic acid blocker chemo drug would include methotrexate, known by the trade name Trexol, pemetrexed, also known by the trade name Alimta, and pralatrexate, known by its trade name Folatin. And here on this image we see the chemical structures of both folic acid here on top, and then methotrexate here on the bottom. You can see just by the chemical structures just how similar these two compounds are. Alright, now we'll talk about a different category of chemotherapy drugs. These are the alkylating chemotherapy drugs. Now, the process of alkylation, this is a chemical reaction in which an alkyl group from the chemotherapy drug is substituted for a hydrogen molecule in the DNA or the RNA. When this happens, this causes abnormal cross-linking within the DNA strands. And when these cross-links happen, the cancer cells can't divide. There are various different kinds of alkylating chemo drugs. One group is the nitrogen mustard chemotherapy drugs. And these act by inserting an alkyl group into the DNA. This will cause a cross-linking to occur, and then the DNA can't be produced normally, and therefore the cancer cells can't divide. Some examples of nitrogen mustard chemo drugs: chlorambucil, known by the trade name Leukeran, cyclophosphamide, estramustine, known by its trade name Emcit, ifosfamide, known by the trade name Ifex, mechlorethamine, known by its trade name Mustargen, and melphalan, also known by its trade name Alkeran. In this image we see a bottle of the drug Alkeran, and this chemotherapy drug is only used to treat two different kinds of cancers, ovarian and multiple myeloma. Another kind of alkylating chemotherapy drugs are the nitrosourea chemotherapy drugs. And these act by inserting an alkyl group into both the DNA and also the RNA. And when this happens, neither the DNA or RNA can be produced, and therefore the cells or cancer cells can't divide. And this kind of chemotherapy drug will also inhibit various enzymes throughout the cell. And some examples of nitrosourea chemodrug would include carmastine, known by its trade names Glidel and BICNU, lomustine, known by its trade name CNU, and streptozocin, which is known by its trade name Zanosar. Now, there are other examples of other alkylating chemotherapy drugs. These all work in the same manner. They insert an alkyl group into the DNA, but they also have other effects that prevent the cancer cell from dividing. Some of these other alkylating chemodrugs would include altretamine, also known by its trade name Hexalin, bendamustine, known by its trade name Trienda, busulfan, known by its trade name Myloran, dacarbazine, known by its trade name D-Tic-Dome, and thiotepa, known by its trade name Thioplex. Another kind of chemotherapy drug I will talk about are the demethylating chemotherapy drugs. And these act because they inhibit the enzyme methyltransferase. Now, this enzyme normally will transfer a methyl group and insert it into a DNA, and this process is called methylation during cell division. So a demethylating chemodrug will inhibit this enzyme from working. So when this happens, the DNA will lack that methyl group, and therefore the cell can't divide. And these kinds of drugs will particularly affect rapidly dividing cancer cells. And these have a direct cytotoxic effect on abnormal blood cells in the bone marrow also. So these are used to treat leukemia and lymphomas. And some examples of demethylating chemodrugs would include azacitidine, known by its trade name Vidaza, and decitabine, also known by its trade name Dacogen. Another kind of chemotherapy drugs are the chemotherapy antibiotic drugs. Now, these are not interchangeable with regular antibiotic drugs. So if we're talking about a regular human cell, a normal human cell will have a cell membrane, not a cell wall, and a normal human cell is not affected by antibiotic drugs because they're used to treat bacterial infections. But human cells are affected by chemotherapy antibiotic drugs. This class of chemodrugs will inhibit the production of DNA and RNA and some cellular proteins. And some of these drugs will block the enzyme that will normally split the DNA strand into two strands prior to cell division. And this class of chemodrugs is used to treat different types of cancers. And some examples of chemotherapy antibiotic drugs include bleomycin, dactinomycin, known by its brand name Cosmogen, daunorubicin, known by its trade name cerebidine, doxorubicin, known by its trade name adriamycin, epirubicin, known by its trade name Elance, idarubicin, known by the trade name idomycin, mitomycin, and lastly valrubicin, known by its trade name Valstar. In this image we have an example of a syringe filled with epirubicin. Now, most chemotherapy drugs are going to be clear in appearance, but epirubicin, also known by the brand name Elance, has a very unique bright red color to it. And this drug is only used to treat breast cancers. And one other drug also has this bright red color, and that would be doxorubicin. Now we'll mention a quick historical note about doxorubicin. In the 1950s, Italian researchers extracted the drug doxorubicin from a fungus-like bacterium that was found in the soil near an ancient castle in Italy. This bacterium produced a very bright red pigment, and French researchers discovered it at the same time also. Now, together, both groups decided on a name for the drug, daunorubicin, which was taken from Doni, which is an ancient people that lived in that region of Italy, and rubis, which is the French word for ruby, because they have the red color. Now, Italian researchers then modified the drug and named the new generic drug doxorubicin, and assigned the trade name andriamycin, which is named after the Adriatic Sea, which is off the coast of Italy. Now, some chemotherapy drugs have an older drug name that were used before clinical trials, before the generic and trade name drugs were marketed. This is the case for doxorubicin, which is formerly known as daunorubicin, dactomycin, which is formerly known as actinomycin D, cisplatin, which is formerly known as cisplatinum, and for many other chemotherapy drugs. Another kind of chemotherapy drug that we'll go over are hormone chemotherapy drugs. Now, certain cancers need hormones to grow, such as cancers that arise from tissues that are influenced by male sex hormone, testosterone, and the female sex hormones. Now, the cancers will have receptors on the surface of their cells for those hormones, and the growth of these cancers is stimulated by the presence of those hormones. So the actions of chemotherapy drugs that treat these kinds of cancers work because they block the effect of those hormones, or they surround the cancer cells with the hormone that has the exact opposite effect. And one type of the hormone chemotherapy drugs include the androgen hormone drugs. And these act in a way similar to that of the main male hormone, testosterone, which is produced by the testicles. And these are used to treat breast cancer in females because they create a male hormone environment, which is exactly opposite that the breast cancer cells need to grow. And these kind of chemotherapy drugs are Schedule 3 drugs. And some examples of them would include fluoxymesterone, which is known by the trade name Androxy, methyltestosterone, known by the names Testrid and Verilon, and testosterone, known by the trade name Deletestrel. Another kind of hormone chemotherapy drugs that you'll find are anti-androgen hormone chemotherapy drugs. These will bind to and block receptors in the prostate gland that is normally stimulated by testosterone. So with the effect of testosterone being blocked, the cancer in the prostate gland can't grow. And some examples of this kind of drug would include bicalutamide, known by the trade name Casodex, enzalutamide, also known by its trade name Xtandi, flutamide, and nilotinib, also known by its trade name Nilandron. Another class of hormone chemotherapy drugs are the estrogen hormone chemotherapy drugs. And these act in a way that's similar to that of the main female hormone estradiol, which is produced by the follicles of the ovary. And this is used to provide palliative treatment for advanced breast cancer and advanced prostate cancer. And these will provide relief from symptoms, but not intended to cure the cancer. Some examples of this kind of drug would include conjugated estrogens, such as Premarin, esterified estrogens like Manest, estradiol, also known as the trade names Delestrogen and Estrace, and Raloxifene, also known by its trade name Evesta. Another class of hormone chemotherapy drugs are the SERMs, the selective estrogen receptor modulator drugs. Well, these will bind to and block receptors in breast tissue that would normally be stimulated by estradiol. So with the effect of estradiol being blocked, the cancer in the breast tissue can't grow. Some examples of this kind of drug would include fulvestrant, also known by the trade name Faslodex, tamoxifen, and torimifene, also known by the trade name Fariston. Another example of a hormone chemotherapy drugs are the progestin hormone chemotherapy drugs. Now these act in a similar way to that of the normal female hormone progesterone, which is produced by the corpus luteum of the ovary. And this is used to treat breast cancer in females because they contain a different female hormone other than estradiol, which is what the breast cancer needs to grow. And some examples of this kind of drug would include medroxyprogesterone, also known by the names Provera, Depo-Provera, Megestrol, also known by its trade name Megace. Another example of hormone chemotherapy drugs are the gonadotropin-releasing hormone chemotherapy drugs. Now this is a synthetic reproduction of the body's own GnRH, gonadotropin-releasing hormone. So this is an analog of GnRH. Now normally this is produced in the hypothalamus, and it would cause the testes in men to produce testosterone, and will cause the ovaries in women to produce estradiol and progesterone. So these gonadotropin-releasing hormone drugs will compete with the GnRH and end up blocking the GnRH receptors on the anterior pituitary gland. So therefore, the anterior pituitary gland is not stimulated to secrete luteinizing hormone. So when this happens, testes don't produce testosterone, and without testosterone, the prostate gland cancer can't grow. And also, the ovaries won't produce estradiol or progesterone, and without those, the breast cancer and the ovarian cancer can't grow. And some examples of this kind of drug would include goserelin, also known by the name Zoladex, Histrelin, known by the trade name Vantis, Luprolide, known by the trade names Lupron and Eligard, and Triptorelin, known by its trade name Trelstar. Another kind of hormone chemotherapy drug that we'll talk about are the aromatase inhibitors. Now, during menopause, the levels of estradiol that's secreted by the ovaries will decline. And the main source of estradiol in postmenopausal women are androgens from the adrenal glands. So these androgens that are secreted by the adrenals are converted to estrone and then finally estradiol by the enzyme aromatase. So aromatase inhibitors will bind to the enzyme aromatase and then prevent it from working. So without estradiol being created, the breast cancer cells can't grow. Now some, but not all, of these drugs are used to treat cancer of the prostate gland in men, because they provide the opposite hormonal environment that the prostate cancer cells need to grow. Some examples of this type of hormone chemotherapy drugs would include anastrozole, also known by its trade name Arimidex, letrozole, known by its trade name Femera, exemestane, known by its trade name Aromacin, and testolectone. Another type of chemotherapy drug are the mitosis inhibitor chemotherapy drugs. Now these will act at very specific times during the early stages of mitosis. And they work because they affect dividing cells to keep them from completing the process of cell division. And this kind of drug will have the greatest effect on cells that divide often. And the effect is felt more on cancer cells than it would be found on normal cells. Now mitosis inhibitors come in a few different forms. One of those are the podophyllitoxin chemotherapy drugs. And this is a semi-synthetic drug that's made from a toxin found in the fleshy root of the mayapple. This drug works by doing a variety of different things. It can keep DNA from being formed. It can actually break strands of DNA. And it can cause the DNA strands to abnormally cross-link to one another. Some examples of podophyllitoxin drugs would include adiposide, known by its trade names etoposide or Vepicid, and tenipicide, known by its trade name Vumon. Another type of mitosis inhibitors are the topoisomerase inhibitor drugs. And these will affect the enzyme topoisomerase. Now normally, this enzyme will relieve the twisting stress on the spiral strands of DNA, and it will cause a break in the single strand so that the strand can separate cleanly and be copied during cell division. And then that break is later repaired throughout cell division. Topoisomerase inhibitors will bind to the enzyme topoisomerase, and it prevents the enzyme from creating that initial break in a DNA strand. And because of this, the cancer cells can't divide. Some examples of a topoisomerase inhibitor would include irinotecan, known by its trade name Camptosar, mitoxantrone, known by its trade name Novantrone, and topotecan, known by its trade name Hycamptin. Another type of mitosis inhibitors are the taxane chemotherapy drugs. And these work because they disrupt the microtubular network in the cytoplasm during cell division. Now, as a cell divides, centrioles will migrate to either end of the cell, and the microtubules form spindle fibers that radiate from the centrioles and connect the chromosomes. Now, the taxane chemotherapy drugs still allow the microtubules to form, but the microtubules don't function properly. And some examples of a taxane chemotherapy drug would include cabazitaxel, known by its trade name Geptana, docetaxel, known by its trade name Taxotere, and paclitaxel. All right, now we'll talk a little bit more in depth about the role of microtubules in cell division. Now, as a cell divides, it goes through certain stages. Now, the chromosomes within the nucleus have to replicate and then divide. So during the process, you have microtubules, or spindle fibers, will migrate to either end of the cell, pulling the chromosomes with them. So this will align the parent and the daughter chromosomes across the diameter of the cell in a single line. So some of the parent chromosomes and some of the daughter chromosomes are pulled by the microtubules to opposite ends of the cell. Then after this process, the cytoplasm of the cell will split to form two distinctly different and separate cells. So microtubules will play a prominent role in directing the location of the chromosomes during cell division. So that's why some chemotherapy drugs target the microtubules. Another type of mitosis inhibitor chemotherapy drugs are the vinca alkaloid chemotherapy drugs. And these interfere with the production of DNA and also RNA. They can also interfere with cell metabolism and the production of the energy that's needed to complete cell division. And these kinds of drugs will bind to tubulin within the microtubule. And some examples of vinca alkaloid would include vinblastine, known by the trade name Velban, vincristine, known by the trade name Vincazar, and vinorelbine, known by its trade name Navalbine. Some other examples of mitosis inhibitor chemotherapy drugs. These belong to a different group of drugs called the epithelone drugs. And these also act on the microtubules to disrupt mitosis. And these are used to treat breast cancers. And some examples of this kind of drug would include eribulin, known by its trade name Halaven, and also the drug exabepilone, known by its trade name Exampra. Another kind of chemotherapy drug that we'll talk about are the platinum chemotherapy drugs. And this will contain the precious metal platinum. This will create crosslinks within the DNA strands. This is used to treat many different kinds of cancers. And some examples of a platinum chemotherapy drug would include carboplatin, also known by the trade name paraplatin, cisplatin, and oxaliplatin, also known by its trade name eloxetin. Another kind of chemotherapy drug we'll talk about are chemotherapy enzyme drugs. And these drugs will have the enzymes that break down the amino acid asparagine. Now, humans can synthesize their own supply of asparagine, So this is not one of the essential amino acids that you must get from your diet, but we can produce this on our own naturally. But leukemia cells, however, cannot synthesize their own asparagine, so they need to get another source of asparagine in order to make proteins. So by using chemotherapy enzyme drugs, you can break down asparagine so the cancer cell can't use it to build protein, and therefore it can't divide. And some examples of this kind of drug would include asparaginase, also known by the trade name Elspar, and also the drug pegasparase, also known by its trade name Oncasper. The next type of chemotherapy drug we'll talk about are the retinoid and rexinoid drugs. Now, these will be structurally related to vitamin A, which is also known as retinoic acid. Now normally, vitamin A, in particular in the skin, will regulate cell differentiation and growth. Now these kinds of chemotherapy drugs will bind to vitamin A receptors on cancer cells and help them become more normal in their cell differentiation and their growth. And some examples of this kind of chemotherapy drug would include alitretinoin, known by its trade name Paneritin. This is used topically to treat cancerous skin lesions of T-cell lymphoma and also of Kaposi sarcoma. Bexarotene, also known by its trade name Targetin, and this is used to treat the cancerous skin lesions of T-cell lymphomas. Tretinoin, also known by its trade name Vesinoid, and this is used to treat leukemia. Now the generic drug tretinoin is also available as a topical drug. As the trade name drug Retin A, it is used topically to treat acne vulgaris. As the trade name drug Renova is used topically to treat skin wrinkles. Our next kind of chemotherapy drug we'll talk about are monoclonal antibody drugs. These are created using recombinant DNA technology. This process will take a human antibody and modify them, and these will selectively bind to specific antigens on the surface of cancer cells. As a monoclonal antibody combines with the antigen, it destroys the cancer cell. Some examples of a monoclonal antibody drug would include alemtuzumab, also known by its trade name Campath, bevacizumab, known by its trade name Avastin, cetuximab, also known by its trade name Erbitux, ipilimumab, also known by its trade name Yervoy, obinutuzumab, known by its trade name Gazyva. Other examples of monoclonal antibody drugs: ofatumumab, also known by the trade name Arzera, panitumumab, also known by its trade name Vectibix, rituximab, known by its trade name Rituxan, and trastuzumab, known by its trade name Herceptin. So another kind of monoclonal antibody drugs are combination drugs. These will contain a monoclonal antibody drug and a radioactive isotope that's used to treat non-Hodgkin lymphoma. And some examples of this kind of combination drug would include Bexar, which is a combination of tositumumab and also iodine-131, and also the drug Zevalin, which is a combination of ibritumumab, indium-111, and yttrium-90. Alright, now we'll talk a little bit more in depth about targeted chemotherapy. Now, these are drugs that block the growth of cancer cells by targeting and interfering with specific molecules on the cancer cell. Some examples of this would include the SERM chemotherapy drugs, the selective estrogen receptor modulators. Other examples would include the monoclonal antibody drugs. Another type of chemotherapy drug, immunomodulator drugs. These will modulate and regulate the immune system. And these are active against cancer cells. And the way they act is they will inhibit inflammation, and they will also inhibit the formation of new blood vessels. An example of a immunomodulator chemotherapy drug are interferon chemotherapy drugs. Interferon chemo drugs will treat viral diseases such as hepatitis. And some examples of this type of drug would be interferon alpha 2b, known by the trade name Intron A, and also PEG interferon alpha 2b, known by its trade name Resilatron. Another example of an immunomodulator drug would be interleukin. And interleukin is a chemical that will stimulate lymphocytes to attack viruses and also activates the natural killer cells, or the NK cells, that look for and attack cancer cells. An example of this kind of drug would be aldesleukin, known by its trade name Proleukin. Now, some immunomodulators are only used to treat multiple myeloma. And examples of this would include lenalidomide, known by its trade name Revlimid, pomalidomide, known by its trade name Pomalyst, and thalidomide, known by its trade name Thalamid. Now, did you know about the drug thalidomide? Thalidomide was once used to treat morning sickness in pregnant women in Europe, but it caused severe birth defects in their babies, so it was taken off of the market. Now, it would have been an obscure footnote in medical history, but in 1997, it was discovered that thalidomide was useful in treating cancers. Another kind of chemotherapy drug are the kinase inhibitors. Now, these drugs will block kinase enzymes that act on amino acid molecules by adding a side molecule of phosphate. So these will inhibit the action so that the cancer cells can't divide. There are many examples of kinase inhibitors. Some of them include axitinib, known by its trade name Inlyta, bosutinib, also known by its trade name Bosulif, cabozantinib, known by its trade name Comatric, crizotinib, known by its trade name Xalkiri, dabrafenib, known by its trade name Tafinlar, dasatinib, known by its trade name Sprycel, erlotinib, known by the trade name Tarceva, everolimus, known by the trade names Zortress and Afinitor, gefitinib, known by the trade name Arissa, abrutinib, known by the name Bruvica, imatinib, known by the brand name Gleevec, lapatinib, known by the brand name Tykerb, nilotinib, known by the brand name of Tasigna, pazopanib, known by its trade name Votrient, regorafenib, known by the brand name of Stivarga, sorafenib, known by brand name Nexivar, sunitinib, known by its brand name Sutent, temsirolimus, known by the brand name of Toracil, trametinib, known by the brand name of Mechanist, and lastly, zemurafenib, known by its brand name of Zelboraf. There are other types of chemotherapy drugs that are more miscellaneous, such as arsenic, which will be sold as the trade name of Trisonox, BCG Live, sold under the brand name of Therasis, bortezomib, sold as the brand name of Velcade, Danileukin diftitox, known by the name of Ontac, hydroxyurea, known by the brand names of Droxia or Hydria, Miditane, also known by the trade name of Lisidrin, procarbazine, known by the trade name of Modulane, romidepsin, known by its trade name Istidax, temozolomide, known by the trade name of Temodar, and Varenostat, also known by its trade name Zolinza. Another type of chemotherapy drugs are the corticosteroid drugs, and these are derived from the anti-inflammatory hormone cortisol, and these are given to decrease the tissue inflammation that's caused by chemotherapy drugs. And these act directly to suppress the production of excessive white blood cells in patients with leukemia or lymphoma. These are also used to treat the anemia that's caused by chemotherapy drugs. Alright, next we'll talk about Chemotherapy Protocol, and this was introduced in the late 1960s. And this will combine the effectiveness of several chemotherapy drugs and direct them against one specific type of cancer. Prior to this, only single-agent chemotherapy drugs were used. So when it comes to selecting drugs for a protocol, the success of each drug in treating that type of cancer is compared with that of other drugs. And the most successful drugs are combined into one overall protocol. And when looking at a chemotherapy protocol, you need to look at the different therapeutic effects of the various chemotherapy drugs. So you want to maximize the effectiveness of the overall therapy while minimizing the side effects that would be caused by a large dose of just one drug. And today, chemotherapy protocols are used to treat nearly every type of cancer. And these protocols are designated by acronyms that combine the first letters of the generic or the trade name drugs or an abbreviation of a drug name in the protocol. So for example, the protocol MAC, M-A-C-C. That protocol is a combination of methotrexate, adriamycin, cyclophosphamide, and CINU, so MACC. Alright, now we'll talk about drugs that are used to protect against chemotherapy toxicity. Now, chemotherapy drugs will target rapidly dividing cancer cells. Now, side effects of these drugs are felt in other parts of the body where cells normally divide rapidly, such as in the lining of the mouth, or in the intestines, or in bone marrow. Now, some drugs are used to treat oral mucositis and dry mouth that are caused by chemotherapy drugs, or by radiation. And these drugs would include amifostine, also known by the brand name of Ethiol, palifermin, also known by the brand name of Kepivance, and pilocarpine, also known by the trade name of Salogen. The other type of drug that could be used to treat chemotherapy toxicity are granulocyte colony stimulating factor drugs. And this is a substance that is normally produced by the body, and this will stimulate the production of neutrophils, which is a type of white blood cell. So granulocyte colony stimulating factor are given to treat decreased levels of neutrophils that often occur after chemotherapy or bone marrow transplantation. And neutrophils are white blood cells that kill bacteria and fight infection, and they belong to a class of white blood cells called the granulocytes. Now, these drugs are produced by recombinant DNA technology, and by inserting the human gene that produces granulocyte colony stimulating factor into rapidly dividing bacteria or in yeast cells. And some examples of this kind of drug would be filgrastim, also known by the brand name of Neupogen, pegfilgrastim, also known by the brand name of Neulasta, sargramstim, also known by the brand name of Leucine. So another type of drug that would fall in this category are the cytoprotective drugs. Now, some chemotherapy drugs are known to be toxic to particular organs of the body. So when a patient receives a chemotherapy drug that is known to be toxic to a certain organ, the patient is also given a drug to protect that organ from toxicity. And these drugs exert a cytoprotective effect that will protect the cells of that organ against the toxic effects of that chemotherapy drug. Some examples of cytoprotective drugs include amifostine. This will protect the kidney from toxicity due to cisplatin or cyclophosphamide. Destrazoxane, also known by the name Zencard. This helps to protect the heart from toxicity due to doxorubicin and also epirubicin. Leucovorin, also known by the name Welcovorin. This will protect against toxicity due to methotrexate and also fluorouracil. Levoglucovorin, also known by the brand name of Fusilev. This will also protect against toxicity due to methotrexate or fluorouracil. Mesna, also known by the name Mesnex. This will protect the bladder against toxicity caused by ifosfamide. Sodium thiosulfate. This will protect the kidneys from toxicity due to platinum chemotherapy drugs. Now, some drugs are used to stimulate red blood cell production to treat anemia that is a result of the cancer itself, or due to radiation therapy, or because of chemotherapy drugs. And some drugs that fall in this category include darbepoetin alpha, also known by the trade name Aranesp, and epoetin alpha, also known by the name Procrit or Epigen. Now, the drug Epigen has a therapeutic effect similar to that of the naturally occurring hormone erythropoietin, or EPO, that is secreted by the kidneys in response to anemia. Erythropoietin increases the rate at which red blood cells are produced in the bone marrow, and this effect will be decreased in cancer patients. Now, some drugs are bone resorption inhibitor drugs, and they're used to treat elevated levels of calcium that's caused by cancer or by bone metastases. And some examples of this kind of drug would be gallium nitrate, also known by the brand name of Ganite, abandronate, also known by the brand name Boniva, pamidronate, known by the brand name Redia, and zoledronic acid, also known by the trade name of Zometa. I now talk about antiemetic drugs that are used with chemotherapy. Now, chemotherapy drugs, like we mentioned before, will kill rapidly dividing cancer cells, but they also affect the normal cells of the gastrointestinal tract that divide rapidly, and this will cause irritation. Chemotherapy drugs will stimulate the vomiting center within the brain, and some chemotherapy drugs will cause the release of serotonin in the small intestine, which will stimulate the vomiting reflex. So nausea and vomiting occur as a result of chemotherapy. It's a very common side effect of chemotherapy drugs. Now, this can be so severe and prolonged that without an antiemetic drug, some patients might elect to discontinue the life-saving chemotherapy totally. Now, antiemetic drugs are often given prophylactically prior to beginning chemotherapy. Now, these drugs, many of which will block serotonin, are used specifically to treat the nausea and vomiting associated with chemotherapy. And some examples of antiemetics that are used just for chemotherapy include aprepitant, known by the brand name Amend, dolasetron, known by the brand name of Enzyme, dronabinol, known by the brand name of Marinol, fosaprepitant, granisetron, also known by the brand name of Chytrol, nabilone, also known by the name Cazamet, ondansetron, also known by the brand name of Zofran, palonosetron, also known by its brand name of Aloxi. I will end this chapter with a did you know? The Latin name for the marijuana plant is Cannabis sativa, and the active components of marijuana that produce the physical and psychological effects are known as cannabinoids. And the antiemetic and Schedule III drug dronabinol, also known by the name Marinol, is a cannabinoid and is also known by its chemical name delta-9 tetrahydrocannabinol, abbreviated delta-9 THC, or just THC in general. So in addition to its use as an antiemetic drug, Marinol is also used as an appetite stimulant for patients with AIDS. And another antiemetic drug, nabilone, is a Schedule II synthetic cannabinoid drug. Alright, that brings us to the end of our chapter on chemotherapy drugs. We will continue our video series on pharmacology with our next video on chapter number 23, vaccines.